is a common symptom among the adolescents. So they have to face the anxiety, and they have to, and the teachers should try to remove the anxieties also. So now I will tell you how the anxieties are different varieties and how to remove the anxieties. So here I will tell you today. I will start with types of anxiety disorders. And I told you yesterday how the anxiety disorder is very frequent, and anxiety is very natural also. We are all having anxiety, but in adolescent, the anxiety is very common. So the anxiety disorder, the anxiety problem, is of two types. One is specific anxiety, other is generalized anxiety. And the generalized anxiety or anxiety disorder can be identified when the anxiety is chronic. Chronic means continuing for a long period, and also uh, it is about uh, exceeding 1 year, like that. It may be continuing, and it is involving multiple areas like anxiety concerned with family, with the school situation, health disorders or health problem. So all these factors contribute to anxiety. So the anxiety is chronic and involving excessively to all these areas. And here there is one also separation anxiety, and here there is anxiety leading to excessive fear of being separated. When the students start going from their home to the schools, for example, to go to the hostel, to go to the boarding. So when they come to the hostel, they have the uh, fear of being let out from the home, or the fear of being separated from home, or the fear of being separated from home, or separated from the caretakers, separated from the friends. That is also an anxiety, separation anxiety. But the specific anxiety relates to some specific areas. For example, specific phobia is in one irrational fear. Irrational fear. So we are having all fear, rational fear. We are having fear to one particular object identified to be fear causing. Sometimes there is no rationality to have a fear. There is no ground to show fear, but you are still having fear. That is irrational fear. So the irrational fear may be with some specific object or situation, like spider. Usually, the girls are very much afraid of the spider, of the cockroach, of the frog. We are all afraid, but the girls are more. And this fear towards spider is irrational. The fear towards lizard, cockroach, irrational. They are all harmless creatures, but we are having very much fear. The fear about needle. Sometimes some people they have fear to go in the elevator, riding elevator. So these fears are irrational but specific. Sometimes we are having fear, social phobia. We have fear to meet the people around. We avoid social setting. Some students avoid going picnic. Some even avoid going mall to attend parties, marriage parties, even to go to school. They avoid because they are having social phobia. They avoid social interactions or to face others. Some students or some adolescents have panic disorder. The panic disorder is unexpected brief episodes of intense anxiety without any apparent trigger, without an apparent cause. Without an apparent cause, we are having brief episodes of intense fear. That is panic disorder. or intense anxiety, panic disorder. This panic disorder is characterized by multiple physical symptoms like shortness of breath, or the heart rate, increased heart rate, or sweating in the body. That is panic disorder. Apart from this anxiety, we are having also depression in adolescents. The depression is very common and manifested in different ways. And the depression also vary individually. Sometimes we are being sad. Sometimes we are being very more irritable. The depression manifests itself in different states, conditions. This depression involves some type of disorders like adjustment disorder with a depressed mood. The adjustment disorder with a depressed mood is also called as a reactive depression. This occurs as a response to life event. Some life event, because of their negative nature, they actually arouse depression in some adolescents. This may be example. For example, this may be insult in the classroom. It may be rejection or disapproval. It may be abandonment. It may be death of the loved ones or near and dear ones. It may be separation between the parents or divorce between the parents. It may be due to change of home or change of school. In such cases, there may be adjustment problem leading to depression, depressive mood. That is called adjustment disorder with a depressed mood, to which you call reactive depression. Sometimes we are having a very persistent depression disorder, like dysthymia. It's a low grade but chronic depression, continuing for more than a year. So now the adjustment disorder is something different. It's not such much prolonged, but here it is very persistent, prolonged, continuing more than a year. Manifested in irritability, low energy, low self-esteem, helplessness, disturbed eating and sleeping behavior, poor concentration and decision making. This type of depression, though not severe, but since it prolonged or continuing, it affects the system and makes the person prone to other mood disorders. Where also disruptive mood and dysregulation disorder that comes in younger children is chronic and severe irritability, frequent temper outbursts, anger, typically which progress into anxiety and depressive disorder in adolescence. Specifically in girls, a gender problem is there also. In girls, before menstrual period, that is premenstrual dysphoric disorder. So in puberty, there's a hormonal changes, and before the menstrual cycles, actually 1 week before, we have a period of depression, and the depression continues for some days after the cycle is over. That is premenstrual dysphoric disorder, which comes with hormone. So now these are the type of depressions the adolescents they face it, they have it, suffer it. So now the causes of depression. The causes of depression, there are some common causes. For example, the family history. If the parents, siblings, they are undergoing depression frequently, then he has to be. The family history counts. Then the stress related to personal, social, and academic domain, for example, at home, in school, or in other environment. Third, the history of abuse or neglect, physical or emotional trauma, including exposure to loss of parent, loss of caregiver, violence, or bullying. That is history of abuse or neglect. That leads to depression. Fourthly, substance use, for example, smoking, alcohol, drug use, that also leads to depression. Fifthly, medical or neurological illness or trauma, like brain injury, terminal illness, that also leads to depression. Sixth, the developmental stages, developmental period, the learning or behavioral disorder, the developmental disorder, the learning disorder, the behavioral disorder, they also contribute to depression. Lastly, gender identity or sexually related issues or leads to depression. Apart from this, there are some other causes like use of drugs or nicotine. The side effects cause depression like high BP, COVID-related anxiety. After COVID, the anxiety still was there about COVID. The COVID-related anxiety, worry for the family, or sudden economic changes, sudden economic background in the family, the school break or home confinement. So all these are causes for depression. And the depression can be assessed by the teachers, observing the students in their action, in their speech, in their attitude to authority and peer. So that can be assessed. So now we come to another portion, that is self-injury behavior. Adolescents, they also make self-injury. The self-injury is also called self-harm, is a non-suicidal self-injury. The self-injury means deliberate injury, deliberate hurt, damage to the body. So any deliberate damage to the body surface without any suicidal intent. It is not an accident, also not indirect. It is self-injury, deliberate. So this is like disorder eating or drug abuse. One deliberately does this. The forms of self-injury are different, like one like biting, hand banging, like pulling skin, pulling hair, hitting. So these are all different types of self-injury. That is one type. Second type, cutting, scratching, branding, or burning. That is one other type, another form. The third form is more serious forms of burning, carving, tattooing. These are all third, very difficult, serious forms. And the fourth one is least common, like pulling body hair, punching walls, ingesting toxic substances, or sharp objects. Sometimes the adolescents, they tend to hide injuries and tends to withdraw because others do not see it. So these are all different forms of self-injury. And self-injury leaves signs for knowing the injury. For example, first, the cut or burn mark in the arms, the legs, on the abdomen indicates injury, self-injury. Second, wearing full sleeved clothes. Those who have made self-injury, they always try to use full sleeved clothes. They don't use sleeveless. This means they want to cover the body fully covering the lower limbs also, in home and outside, irrespective of the weather. Even in hot days, you'll find they are covering their body, whole body. That is to hide this injury. Thirdly, the other sign is, so now see, if anybody is covering the body even in the hot days, they are in having this type of dress, you can suspect that he is going to hide some injuries, self-injury. Thirdly, finding knives, leather plates, box cutters, etc. So those people who are making who make the self-injury, you will find these instruments like razor, blades, box cutters, all these sharp weapons, sharp objects hidden in their bedroom. Because they are fond of that. And fourth, regularly locking in bed. They want to lock themselves in bed or bathroom for a long time. They can lock in the bed or lock in the bathroom following a bad day in school. Suppose there is an unpleasant experience in the school, they want to lock themselves up. Or when there have been negative encounter with the peers, or conflict in the family, conflict with the parents, they want to lock down in the bedroom, in the bathroom. That is also self-injury sign. And the lastly, last but one probably, the family physician, the teachers, they observe the cut mark and they observe the adolescents regularly remove their body hairs. They can mark such an injurious mentality from the students. The next point, not only one adolescent is doing that, his peer also doing. When the peers are doing, then he is doing, he has to do. So here his peers cut or burn can also identify him. And lastly, report from sibling about cutting. The sibling can say, the sibling can report. Parents may not say, he hides, but sibling can see. The sibling's report can indicate the signs of self-injury. Now, why self-injury? What are the causes? Number one, doing self-injury is a risk-taking behavior. It is made to rebel, to reject the parents' disciplinary impositions or to reject the family values. So it comes like a risk-taking behavior. Secondly, those who make self-injury, they want to indirectly draw your attention, like a seeking attention. Thirdly, it is a non-verbal method of communication of emotional and physical discomfort. And fourthly, a way to relieve anxiety, frustration. Fifthly, reflecting lack of appropriate emotional communication skill or skills deficit. You do not know adequately communicate, therefore they do that, to communicate non-verbally. Fifth, seeking acceptance or affirmation. Affirmation means the peer, they accept him because he is going to harm himself out of sympathy. So to seek acceptance. They can do that. Next, it can be a coping style. It means a coping style means they want to cope in that way. The coping style is a coping style for higher stress level in home and peers. So it's a form of it also is a form of self-punishment. If you have a guilt feeling, you punish yourself by that. Also, these injuries, self-injuries, they produces endorphin, one chemical. That is endorphin effect. Which gives away unpleasant thoughts and feelings. Again, it's also a way to feel alive. To feel alive. One cut his arm, cut his skin, make a scratch, to feel alive. To confirm existence when you feel emotional disconnection from parents. When emotionally disconnected from parents, when feeling emotionally dead inside or feeling invisible in parents' eye, so he has to make self-injury as a way to feel alive, to confirm his existence. Lastly, self-injury is caused as a coping strategy for girls with overly demanding parents, especially when father is with dominant voice, while discipline and decision is imposed. Then, specifically girls, the boys rebel and the girls, they make self-injury. That is to demand the parents' attention. Self-injury is done intentionally, not to kill himself. It is an intentional self-harm. But there is another self-harm, that is suicide, which results in death. So self-harm not causing death is self-injury. But self-harm leading to death is suicide. Suicide is now very common. Very brilliant students in IIT, very beautiful film heroes and heroines, they are all coming in newspapers are committing suicide. So the question is, why? What is the deficit in them? The heroines in cinema, very beautiful, highly earning. The heroes, like Sushant Singh Rajput, very much earning, very handsome. What was the cause for committing suicide? Many IITians who can get 7 or 8 figures salary, why commit suicide? So suicide is a type of stress effect, and the suicide is nowadays increasing, and there are some predictors or risk factors of suicide which varies with the age, varies with gender and ethnic groups. The predictors can involve some 2-3 factors, 2-3 ways. Like one is personal factor. The first is physical health due to chronic medical condition, or the changes due to puberty, or acute chronic mental health conditions. that can lead to suicide. This is an indicator, this is a predictor of suicide. Secondly, in young adolescents, the impulsivity linked with their sadness, confusion, anger, their self-doubt and feeling of hopelessness causes suicide because they are impulsive, irrational. Thirdly, the easy access to gun, the easy access to drugs, self-harm instrument also leads to suicide. Again, the fear of rejection or humiliation due to being lesbian or due to being a gay or bisexual naturally leads to suicide. Naturally predicts suicide because this indicates a tendency, leads to tendency to commit suicide. In known society, there are many people either gay or lesbian. They are not the fault, but they are by birth having some problems. Maybe hormonal. Maybe having biological causes which cannot be removed, rectified. But those people, because of the lesbian, gay, bisexual, or other social minority status in the youth, the fear of being rejected, or they fear humiliation, therefore they go to suicide. And lastly, the record of past events. Suppose in the past he has made suicide attempts, then he is at risk, he is likely to commit again. So all these 4 or 5 stages you can predict somebody is going to commit suicide. That is a personal factor. At personal level, these factors predicts suicide. And social level, there are social factors. The risk of committing suicide increases with the age. In middle to late adolescence, suicide is more when a child is in late adolescence. The conflict is not resolved. Then naturally goes for that. The females are more likely to attempt. Females do more suicide attempts but die less. But the males, when they attempt suicide, they die. Because the males are having access to gun, having a tool, or then have access to get the instrument for causing death. And thirdly, the anticipation events or no solution one gets, then suicide. Nowadays, in these days, you young people, you will see that if anybody is pregnant unduly, teenage pregnancy or any premature pregnancy, there are all ways to keep you safe. You can eliminate. But in our days, we have seen some cases when any pregnancy is there is no other way except committing suicide. And we have seen many girls committing suicide because of that. So here, the anticipation of humiliation, when there is no solution for some punishment, for abandonment, for some insult, or the teenage pregnancy, for bullying, fight, all these things, then only way is committing suicide to escape the humiliation. Then the other is social isolation. For example, there is a broken family. Nobody takes care of you. You're socially isolated. Then you go for suicide. If from families facing significant physical, verbal, emotional, sexual abuse, so you are in a family facing all these abuses, there is no alternative. You want to finish yourself. Sometimes some adolescents, they behave like copycat. You must be seeing one thing very strange. When you see one IITian commit suicide, after 3-4 days you will see another person commit suicide. After 1 week again seeing another commit suicide. So when somebody commits suicide, it spreads like copycat. Somebody also tries to copy it. So somebody doing this, the other fellow is now influenced. He was in Pakistan, not doing, but when he sees somebody doing, he also does it. He also does it. He has to do it because he has been influenced. That's a copycat attempt. In school, if once in some class somebody comes suicide, the other class also student, or in one class some friends commit suicide, the other friend also doing it. Copycat. Next, last one. Anybody, any adolescent who engaged in addiction, substance use, or having low level of self-control, he is easily frustrated and commits suicide. These are the social factors. So we can say the suicide is indicated through these personal and social factors. The suicide has some warning signals. Somebody suicides is going to commit suicide. So this also leaves some warning signs. Number one, how can you know? The warning signs, number one, there may be change in personality. There may be mood swinging. He's now happy, after some time again unhappy. Mood swinging. Angry, liberal, mood swinging. The feeling of apathy. He's irritable. Showing anxiety, indecisiveness. Showing very fatigue. Saying, complaining, I'm very tired. Stomach ache, headache. Also all the negative self-talk. That I don't want to live. I see. This is my last day today. Like self-talk. Negative self-talk. So these indicating change in personality and also it is sign of committing suicide. Next, the change in behavior. The lack of concentration. Is difficulty. There is a concentration problem. Not able to concentrate on anything. Distracted, changing. There is concentration difficulties. This behavioral change indicates he is going to commit suicide. Thirdly, change in sleep pattern. He is either oversleeping or not sleeping, insomnia. वो बोलेगा नींद नहीं होता है, नींद नहीं लगता है. कभी कभी ओवर स्लीपिंग, ज्यादा सो रहा है, कभी कभी नहीं सो रहा है. ओवर स्लीपिंग और इंसोम्निया. अर्ली वॉकिंग, rises very early at 3 o'clock, getting up. The nightmare. So the changes in sleep pattern indicates he is going to do something. And also the change in eating habit. He will complain, loss of appetite. Sometimes also overeating. But the loss of appetite is common. He's not going to eat anything. Next, the fear of losing control. He will active erratically, impulsively. He has no loss of he has no control in behavior, losing control because he is impulsive. He is harming self, harming others also. Next, he has low self-esteem. This low self-esteem indicates the feeling worthless. ये सोच रहा है कि मेरे हाथ में कुछ नहीं होगा, मैं कुछ नहीं करने पाएगा. ये फीलिंग वर्थलेस. सेम सेल्फ हर्टेड, अपने को गाली कर रहा है, मेरे हाथ में कुछ नहीं होगा, इसके लिए मैं जिम्मेदार हूं, इतना जो प्रॉब्लम हो रहा है मैं जिम्मेदार हूं. सेल्फ हर्टेड, गिल्ट फीलिंग, दैट इज हिज लो सेल्फ एस्टीम लीड्स टू सुसाइड. Next, no hope for future. Then he has no future. He says, my future is closed. मेरा जिंदगी में कुछ नहीं कर पाऊंगा, खत्म हो गया सब. ये जो फीलिंग है ना, no hope for future, suicide. Next, the recent loss, like the death of near one, like the father, like the mother, or the divorce, or the separation between the loved and loved beloved ones, the broken relationship. These recent loss creates him imbalanced, goes for suicide. You know, the love problem causing many suicide instances. So, next point, talking and writing about death or dying. So he talks with his friends about death frequently, about the word of dying also, or writing about death, writing how to die, how people die. So when he concentrates in death, dying habits, all these things, either talking or writing, he can write like, I wish I am dead. Again he can write, I can't meet you further, my last meeting point. So like this type of talking or writing indicates he is going to commit suicide. So these are the signs you know that somebody is going to commit suicide. So the therapist actually now is a problem how to assess suicide. The assessment of suicide. So, you know, the psychiatrists, they could indicate by risk assessment, they can report when a person is having such thoughts or mentally has been very weak. The thoughts and behaviors are predictors. When the adolescent is making plan, rehearsing or preparing the attempt, that is indicating, so you can assess that he is going to commit suicide. The suicide risk screening, that is responding to some questionnaires. From question answer you can know the mentality, one way of assessing. And second is suicide risk assessment by the psychiatrist. So these two ways suicide tendency is assessed. And now we cover suicide. The next is other psychological disorders, the emotional challenges and behavioral disorders, and how to promote the health and well-being. So in the process, you can confront to so many disorders the adolescents are confronting. One of them is psychosis. So it's a type of disorder. These are in thought process. When you see and perceive what others do not, in our perception, in our thought, we're having some disorders. That is about psychosis. Some adolescents actually, they complain some behavioral peculiarities. They see in this way, they perceive in this way. But that type of complaint, nobody gives, only one person gives. Where you keep that? So when one says, I am seeing like this, but not others, then you can say that something peculiarity is there. They hold some peculiar beliefs. One adolescent may complain that he was trying to give me poison. Or I saw this, I saw somebody is asking me to do this. So these are all indicating psychotic thoughts, psychosis. So how can I identify psychosis? Who is having psychosis problem, psychotic? Who is psychotic? How can you know? There are 6-7 points how to know psychotics. Number one, hearing voice. A person will complain that I'm hearing a voice, I'm hearing a sound. Somebody is having a sound. Somebody is saying me, you run, don't stay here. Or somebody is saying me, he's coming to kill you, be prepared. So these voices, this sound, one hears, but no others else hearing. This means this body is suffering from psychosis. Then also, he says that somebody is talking in the room. Nobody is there, but somebody is talking. Somebody is discussing with a person. Or somebody is giving instruction, do this, do that. Somebody is crawling on the skin. A strange fact. A type of strange tactile sensation. Whether somebody is on the skin, somebody is walking on my chest or on in my undergarment. There's nothing but complaint there. He can complain about seeing image. But nobody is seeing, but she is seeing. The image is not visible, but he say I am visible. I am seeing. Then experiencing smell. He says that his room is filled with beautiful smell. Or I'm getting good taste in my tongue, very beautiful taste, very tasty. Or nothing to give smell, but is experiencing smell. No food, but tasting the taste. So without any physical stimulus, he is having these sensations. That is indicating he is having psychosis, psychological problem, psychosis. Apart from this, the psychotics have some thought disturbance. For example, first, they have difficulty in organizing thoughts. Their thoughts are not organized. They are having difficulty in taking, when they are asked about something, they are not able to talk meaningfully. When they are talking, they will find there are gaps, no link. It's not meaningful. And also, while talking, they jump from one to another thought. Very jumpy. Sometimes not able to think at all. Sometimes suddenly he feels a firm belief that I am possessed with unusual power. I can change the world. I am God. I can do what I like. This type of feeling. Also, again he can say, some are against me. Again, he can say that someone is reading his mind, someone is following him. He can complain. Now my secrets are being known to another person. I got a recent case. One lady, one OS officer here in Odisha, she complained that every day I change 2-3 days. I use a particular SIM in a mobile because somebody is hacking it. I don't know why somebody hacks it. I do not know. Frequently being hacked. That is a type of psychosis. He says that my secrets are transmitted to others. He suspects others might harm him. And also, thirdly, you can find, apart from thought, there may be disorganized motor activities or behavior. They are gesturing, muttering, laughing without reason. They laugh, but no reason. Showing gesture like this, that, this, but the gestures are meaningless. No apparent cause for that. Sometimes they appear unusually energetic, very active. They look untired. Sometimes the activity level is very high but inappropriate. They are not moving from one place to another because they maintain the same posture. They have diminished self-care and poor hygiene too. So all these things indicate these are the causes how the psychotic behavior is emerging or how psychotic behavior takes place. So apart from that, also we are having disruptive behavioral disorders. One is ADHD or attention deficit hyperactive disorder. And the ADHD usually occurs before 12 years age and also gradually gets severe. So in these people, no mischief or misconduct. They have only some problem like they fail to give close attention. They make careless mistakes. They have difficulty in holding attention or play activities. If they're playing, after some, they are very much eager to play. But when they start playing, after 3-4 minutes, they say, I don't get happy, I want to change something. So, difficulty in holding attention in tasks, also in play activities. Also, it seems they do not listen when spoken directly. They do not follow instructions. They have troubles in organizing activities. They avoid doing tasks requiring long time, avoid doing school work, avoid doing homework because it's long time involving. They also lose things necessary for tasks, for activities. For example, school material, pencil, and they frequently lose. They are easily distracted and forgetful in their daily activities. And this ADHD can be grouped in different type of activity like hyperactivity, like impulsivity. You can group it. In the hyperactivity group, these ADHD adolescents, they have fidgets with tabs hands or feet, or square size seat. Means they are actually moving their hands or feet repeatedly. The square size seat means in the seat when they're sitting, they're moving, not able to sit quietly, changing the chair position, bending to the front or back repeatedly, looking this side, that side. A square means in the seat. Next, they leave the seat when others are sitting. They feel restless, unable to play or take part in leisure activities. Even if they take part, it is difficult to be doing so quietly. On the go, as if they work as if they are going or driven by a motor. They behave as if they are pushed to that, and they talk excessively. That is about their hyperactivity. And about impulsivity, they blurt out an answer before question completed. You might have seen in the school, you are all teachers. You must have seen in the school, you are asking questions in the classroom. There are students. The question is not finished, but they stand to give answer. Impulsive. Question not completed, but they are ready to give answer. Then they have trouble in writing up to them. They're also having trouble in waiting on his turn or for his turn. There's a queue. They can't wait. They're restless. Thirdly, they interrupt or intrude a social situation in some function. They like to interrupt. That is impulsivity. Or the ADS have these type of activities, hyperactivity and impulsivity. Then you come to there are other disorders also, to which we also say that not affecting others very much, but they are having problems, to which we say conduct disorder. If the behavior continues up to 6 months and maybe more prominent in older ones, that is conduct disorder. This manifests in 5-6 ways. Number one, this involves excessive fighting or bullying. This involves cruelty to animals. They are very cruel. They have killed the animals. And caught or put damage to people also. Thirdly, there are severe destructiveness to property also. They are setting fire. They want to put fire. They can take a fun of putting fire. They are also fond of stealing. They can steal. These are all conduct disorders. Also, other activities like repeated lying, truancy from school and running away from home, unusually severe temper tantrum, defiant behavior, provocative behavior, persistent and severe disobedience. These are also coming under conduct disorder. They are disobedient, provocative in their behavior. And they are common. Another type of disorders also comes in the adolescence, that is eating disorder. The eating disorder is of two types. One is anorexia nervosa, other is bulimia nervosa. The anorexia nervosa is delivered to weight loss. It is reported that the adolescents, while approaching puberty, they fail to get expected weight gain. This is characterized by low body mass or weight loss, self-induced avoiding fat food, or presence of self-induced vomiting, purging, excessive exercise, poor body image with high preoccupation of fatness, self-imposed rules about ideal weight, the endocrine problems, they are all related to anorexia nervosa. Now, see the anorexia nervosa, you will find not eating, weight loss. They don't bother for that. But the other type of is bulimia nervosa. There is bouts of overeating. They overeat to control body weight. They are persistently preoccupied with eating, craving for food, overeating in large amounts, even with short gap. खाने के कुछ समय बाद फिर खाएंगे, ज्यादा खाएंगे, फिर भी खाएंगे बार बार. बट खाएंगे इतना ज्यादा खाएंगे, खाने के बाद फिर they will do self-induced vomiting. Because they want should not be gathering fat also. They use drugs and they have excessive fear of fatness. So they go for vomiting, and vomiting is self-induced. There are some risk-taking behaviors also. Apart from that, apart from eating disorder, there are also other risk-taking behavior like substance use, sexual behavior. Substance use means in other sense they use smoking, they take drugs, alcohol. Sexual behavior also start romantic relationship at the cost of shortage also. Violence, they have gang behavior, grouping. Also, there is sex orientation and sex-related behavior problem or sex-related maladaptive behavior. In the sex problem, number one, they rely on some non-living objects as sex stimuli. Use non-living objects for their sex arousal, that is called fetishism. Then wearing clothes of opposite sex for excitement also, that is fetishistic. Transparency. Thirdly, recurrent tendency to expose genitalia to opposite sex is exhibitionism. Fourthly, recurrent tendency to look at people engaging in sexual behavior like undressing, voyeurism. So these are all problems in sexual orientation. So apart from that, also we are having learning disorder. In adolescence, there are students who are not learning at par with others. It looks they are not interested. They are poor in academics because of sensory impairment, because of less intelligence, because of motor problem, there are chronic medical issues, there have been developmental disadvantages, poor health, language problem. They appear like a doll, but in reality, they have genuine problems. And such learning disorder may be caused by so many factors. Number one, family history. The sibling could be like that if there is a genetic cause in family. They are delayed in comparison to peers in their developmental phases. For example, the language is developing late, the speech late, but the peers have already done that earlier. Besides, these adolescents must have vast difficulties. And these learning disorder cases have problems like left-right confusion. They cannot say which is left side with right side. On the road while going to the left, they will be in right. They have difficulties in tying their shoelace. जूता पहना भी मुश्किल उनके लिए. वॉकिंग स्ट्रेट लाइन, सीधा नहीं चल पाएंगे, चलने के समय ऐसे ऐसे हो जाएंगे. They are having difficulty in understanding prepositions and adverbs in a sentence. During childhood, they have identifying problems. So these teachers can know who are having learning disorder by screening at the class 3 admission stage. And through the principal, the teachers can meet the screening committee to make further planning for those left out or for those identified as learning issues. Thirdly, they can interview the parents for their involvement and motivate them to take extra care. Also, they can refer the cases to local medicals, the medical board for IQ testing. Lastly, they can also collect the disability certificate for these sole learners to get all the educational support. So with this, I complete all the mental health problem. Now I'm coming to the other chapter, that is counseling. I've told adolescence is a challenging period and a taught task for the resident teachers to manage it. We are having a course like guidance and counseling. Guidance and counseling is supporting function in education. Here, the learner has to develop optimum potential. Guidance for curriculum, that is use of art, health or physical education to deal with emotional needs and development. So the guidance has three purposes. It's a guidance and counseling, both are different. The guidance, the purpose is self-development. How to deal with the external stimulation, how to get him developed. So guidance means self-development and counseling means self-reliance, but self-realization. In guidance, there are 4 steps. Number 1, to improve understanding, skill, and how to deal with situation. Number 2, to recognize the abilities, the aptitude, the interest, and the limitations. to identify the talents, to identify the field, the career suitability. That is one big task in guidance. Secondly, to improve healthy interpersonal relationship. And next, to arrange subject matter, the course of learning, and the goal interpretation. Here, we are setting up two main things. One is the curriculum, other is the medium. The curriculum is the content what should be given to the adolescents, and the medium through which you have to pass out the knowledge. And the medium involves four stages. One is the art education. The art education helps in understanding self in relation to others. And secondly, the theater, dramatization that helps in social and cognitive relationship, social factor, and cognitive development. In theater, actually, visually and perform and also performing through your performing art, you are knowing many things, getting more socialized, increasing a self look to know yourself in a better way. And through drama, you are having social and cognitive development. Next, through health and physical education, you are having physical, social, emotional, and moral development. Lastly, through cybernetics, through guidance in cybernetics, you are aware of your career promotion, career choice, career setting. Also, you know the cyber ethics, you know the cyber rules. The cyber ethics is you should have some ethics. For example, you should not open somebody's Facebook. You should not use somebody's mobile. You should not use or open his WhatsApp. You should not read somebody's mail. Cyber ethics. So all these things are taught through guidance. But teachers, they guide you. Do this way, that way, like this. So that you can be well developed. You can be well equipped physically, mentally, socially. You can be well adjusted. So, to sum up all these, we can say that through guidance, you get all the ways or the means for your self development. Now I'm coming to counseling. Counseling is the most important part of school guidance. It is a professional meaning and a popular meaning also. In a popular way, we say the counselor can help you to do everything. But professionally, counselors, they do not give you any suggestions. Do this way, that way. They actually internally make you more developed. You are self-developed. They realize you get self-realized. Means they make you they help you to realize your own potentialities. So now see the guidance. They develop your potentialities. In counseling, they help you to realize your potentialities. Counseling is a skilled use of relationship to facilitate self-knowledge, coping. Is an interaction in a therapeutic meeting. The SCA, American Counseling Association 2010, defined counseling as a professional relationship empowering individuals, families, and groups to accomplish mental health, mental wellness, education, and career goals. These counseling are of different types. The counseling may be individual counseling or group counseling. When a person comes for counseling, single person, one person coming, to get take your help in counseling, it is individual counseling. This individual counseling is personalized, one to one, face to face, and here the counselor is helping the counselee to understand, initiating a positive change in him. Since it's a one-man show, one-one relationship, there is confidentiality. It involves confidentiality. It involves more free interaction, one-to-one, so more free. It involves relation building. You are more related. It involves therapeutic relationship, profound sharing. The difficulties are eliminated. And individual counseling is done only when the individual is very shy. The client is shy, retiring, or afraid. He is afraid that others will know his confidential things. So therefore, this individual counseling is that way helping the person, individual. It is more applicable to persons when the persons are shy, retiring. But there is one disadvantage that in individual counseling, because of the closer relationship, the counselee becomes over dependent on the counselor. So in the rest of the period, rest of his career, he always disturbs the counselor, what to do like that. So here the counselors should try not to be very close. The proximity should be maintained. So in such a way. Then you come to group counseling. The individual counseling is good because it is person to person, confidential, and very convenient also. But group counseling is still better because it involves interpersonal climate. The free communication among the participants develops insight to self. All are freely communicating, so naturally you are also having your own insight developed. So through this, you are evaluating yourself and you all understand each other. In group counseling, you feel closer, you have emotional support also. But here now the question is, in group counseling, how many persons will come in the group? Who will be the members? And who are the members? So the group counseling participants should have a common problem. Suppose the question is examination anxiety. You are coming for a counseling. So common problem is examination fear or examination anxiety. Like this, there should be a common problem. And the theme is usually fixed by students or the group. Also can be taught by teacher also. And the group size should be 8 to 10 maximum, not more than that. The theme, the age, the maturity level, the length of session, the language, the frequency, etc. should be the place also, the place, the date, everything should be decided by the teacher and the group together. The counseling commences in 4 stages. Number 1, initial stage. In initial stage, there is rapport formation. The counselor explains the rules, the role of self, role of group, He tells you to have non-judgmental attitude, to listen carefully, and to healthily accept the feedback. So in the first stage, there is a trust building, familiarity development. That is called rapport formation. Second stage is the transitional stage. In the second stage or transitional stage, you have active interaction. Means you are knowing each other. There is a conflict, a rebellion among the participants. Then he wants to, I want to speak first. Then somebody says, I want to speak first. Like this, the struggle for dominance develops. Then ultimately, you move towards authentic self-exploration. Any any problem? Any problem? Gati
No, sir.
Krishna? Any problem?
No, sir.
So all the participants, I'm asking if any problem, tell me any question you will ask, or
No
you will
problem, sir.
you can go. I can go forward. I can go forward.
Yes,
Yes,
sir.
sir. Yes, sir.
You do give late reply. So these courses are still more. We have to go further. So only 35 minutes, but there are lot of courses pending. So now the third stage, the working stage, and the members are getting closer. They are aware of each other's problem, and they are also sharing, trust building. The cohesiveness also develop. So next stage is confrontation and domination. So you continue the session for 3 to 4 times. Then you discuss, take the session, then you dominate. There is another type of counseling technique that is called peer counseling. The group is a big size, and sometimes the peers, the classmates, they are better counselors. When the school has no counselor posted, then the peers. But the peers actually helps the student very much because students are very free with them. The students are not free with the teachers. They are not free to the counselor. They may not be free with the big group size, but they become very free with the peer. The peer, senior student or the contemporary, they can be the mentor and the mentee or the counselee when he is in difficulty, academically or anything, social also. He can ask the mentor or the peer. The advantage of the peer counseling is both the peer counselor, mentor and mentee, they are benefited. They are having relationship closer also. Secondly, it's economical because others are not involved, no cost financially or otherwise. It's also informal. The peer counselors bridge up the gap between students and the professionals. And the function of the peer counseling is support academic activities. For example, when the counselor is absent in the classroom, not able to follow the academic progress, then he can consult the peer and know it in the inducting level. When the newcomers, when they join the school, they are feeling very uneasy. They are thinking about going back. The atmosphere, the food, the system, everything was very uneasy for them. And the peers, they come into their rescue. They say, don't worry, this is our feeling earlier in our when we joined, but now we are feeling very comfortable. But don't worry. So peer can console them. So at the inducting stage, the peers are very helpful. The peers can make them familiarize with school routine, school ethos, the social cultural environment. The students are from different socio-cultural background, economic background, have competing situations, but the peers can help them to be more concentrating and forgetting all their problems. Here, in the peer counseling, you first of all they identify the area that needs intervention, define the goals, select the peers, and the person who can be the peer, the sympathy, the person who has empathy, the person having mutual respect, the person having self-confidence, who is also is non-judgmental, trustworthy. He can be a good peer. The peer counselors may be trained by the counselor also. The school administration should help them also. The next type of counseling is multicultural counseling, because the residential schools in JNV consist of students coming from different cultures. So the clients are of different cultural background. So knowledge of different culture, gender, gender bias, gender notes, gender rules or values, attitude, the world views, all these things should be known to the counselor. So to develop appropriate intervention technique to address the students' realities, the counselor should be aware of all multicultural norms. That is called multicultural counseling. There is another type of counseling called crisis counseling, and that is the very emotional stage, because when somebody is in crisis, he goes for counseling. We can recall the state of COVID. In COVID, the patient as well as the attendants, they were in crisis, and here the crisis counseling was required. The crisis involves loss of loved ones, or illness, or violence, or sex abuse, or natural disaster, or militancy, or pandemic, when it is difficult to deal alone. That is called crisis. The child abuse, which is physical or mental violence, emotional neglect, sex abuse, depression, trauma, suicide tendencies. So this can be settled up through crisis counseling. So here the counselor should observe closely, identify signs of distress, and help them to cope with stress. So severe illness, suicidal prevention, substance misuse or abuse prevention should be done through counseling, that is crisis counseling. And the counseling involves so many skills. The counselor should be doing his counseling in very comfortable way, like active listening empathetically, then attending. So attending means there is a term like solar. In S, he is squarely facing. When he is attending the patient or the counselor should squarely face, should have open posture. Open posture means हाथ और पैर ये सब मुक्त रहना चाहिए. So no crossing of hands, no crossing of legs, open posture. So leaning towards client. So when you are sitting, you have to lean. There will be eye contact. So there should be paraphrasing. So speaking slowly, empathy. So when you are feeling, he is feeling. So all these things, there are so many ways how to comfortably do counseling. Now the question is, when coming to counseling techniques, the counseling involves so many techniques. So roughly you can divide counseling techniques in two types: behavioral technique or behavioral counseling technique, and the other is cognitive type, cognitive intervention. So in behavioral counseling technique, we know that behavior is always a learned process. Nobody is born with one type of behavior. So we learn to behave in a typical way just through learning. So the behavioral counseling technique indicates that if somebody has a particular behavior and we have to get rid of the behavior, we have to remove the behavior to counseling, then you should know that this behavior to which you want to remove, that is a learned behavior. So anything learned, if not good, you can unlearn it. So remove the behavior through unlearning. So how can you unlearn? By withdrawing reward, by giving punishment. So thereby we are involving conditioning technique. Conditioning is nothing but a technique of association. When you associate, when there is a present association with the behavior, it will be repeated. When there will be unpleasant association, it will be discontinued. And the behavior can involve an ABC design. One is antecedent, the second is problem behavior, third is consequence. So while you are intervening, you want to develop a new behavior. So you can, if one behavior is not appealing to you, you weaken this by modifying the problem behavior through reward and punishment. You strengthen the new behavior which you want to expect and weaken the problem behavior which you want to eliminate by conditioning. This classical conditioning and operant conditioning. The classical conditioning involves a type of association involuntarily, and the operant conditioning involves something voluntarily. For example, I am given an example. In the hostel of the JNB, when there is a meal time in the kitchen, there is a bell ringing. When the bell rings, you will find the dogs. They are salivating because they know after the bell, the students will go for eating, and after they eat, the things will be thrown and we will take the food. So the time conditioning automatically developed involuntarily, automatically. But when you give reward or punishment, you voluntarily change the behavior, you get the reward. That is operant conditioning. So now, through this classical conditioning and operant conditioning, you can change the behavior. So I can tell you some examples like exposure therapy that involves systematic desensitization and in vivo desensitization. It may be involving flooding technique or implosion. Suppose you are having fear of snake. So now you think of this, have the image of snake. Gradually relax your body and you get the anxiety hierarchy. You say, I am putting it here. Or a lizard, you say, lizard is a very soft term, not snake. You say the patient or the counseling, I am putting a lizard in your head. Then he is screaming. Then the lizard is coming down to soldier. Then he jump like this. You just tell on imagination. and when in a relaxed state, and you give this information, then you will gradually find you will get adjusted with that, and the fear towards result will decrease. So here you construct the anxiety hierarchy, you train the relaxation, then you desensitize the stimulus with a list of 10 to 12 episodes. Then you will find the fear is disappeared. So we are exposing that way. So another mental technique is flooding technique. So either imagination, in reality also you can do that. Sometimes you show a snake, plastic snake, then gradually by you holding the plastic snake, the fear reduces. Or somebody is having fear of sea base, seabed, sea water. So possibly take them into the sea, then naturally the fear will go away. I am telling one flooding technique. What is about the child to the mother? Initially the child is crying when it takes bath. What the mother does? Is the mother trying to convince the child? No. Holding the child, dipping him in the little warm water. And first dipping child cries. After dipping, he gets the little warm water and enjoy. That is flooding technique. So here in behavioral technique, you first you desensitize. Somebody having fear means he sensitized with the stimulus or object. You desensitize gradually in a relaxed state. We are using yoga practice like Savasana, the Vipassana, the Pranayam, breathing exercise. All these are to induce a relaxed state. And you have to desensitize the anxiety provoking stimulus by visualizing each item in the list. Gradually, this can help when you are in relaxed state. So here, there is another technique also, implosion. Here, in a relaxed state, you narrate fearful situations through imagination. You will find fear is going away. Also, we are changing behavior through stimulus control by using enforcement. Also by role playing. In role playing, the behavior learned by observing others. Counselor plays client role and the reverse also happen. Role exchanging. Like playing the role of parents, playing the role of a teacher, playing the role of school boy, all exchanging roles. The behavior can also be changed. Also, the behavior can be changed by token economy. Token economy. That is positive reinforcement you give. You give positive reinforcement. Each time the client is exhibiting desired behavior, you give some enforcement with a renewed token. So for the token, you try to change his behavior. You know, you can take the students to picnic, to movie, as a reward. And with this, they can change the behavior also. So, like behavior techniques, we have also cognitive interventions. Aaron Beck, a psychologist, he proposed this cognitive therapy view. So, So he says that learning the behavior is not always by your punishment, also by beliefs, attitudes, or expectation. The behavior is formed. So there is a distortion of thinking or maladaptive behavior which can be modified. So they say we have a thought pattern that is all or non thinking. We think in an extreme form. Either you love or you do not love, like this. For example, a child feels that when his demands are not filled, the parents do not love him. That is like your extreme conclusion. Or there may be overgeneralization. That is either a conclusion. There may be arbitrary influence or the conclusion is unjustified. For example, you saw a person, if the person did not smile, you make conclusion that he did not smile because he is angry with me. He is an arbitrary influence, unjustified. Also, you some make jumping conclusion, like suppose you saw something is wrong in the morning, we say the whole day will go, the whole day will be bad. Or, for example, suppose a person is transported to school where one wrong man is working. Now he thinks this man is working a wrong man, means he doesn't like me, means everybody will be unhappy with me and the school stay will be very hostile for me. Jumping conclusion. Sometimes you magnify the unpleasant experiences and suffer. Sometimes you feel everything I am responsible. The labeling, mislabeling, or discounting positive things, or the emotional reasoning. So all these things lead to maladaptive behavior. So behavior can be changed not by reward or punishment, but by changing the approach. So you have to change your perception. You must make your perception, you must make your thought irrational. There is CBT technique, that's cognitive rehearsal technique. So which can change your cognition. So validity testing, there is guided discovery, like you ask him to, you ask questions on his feelings, thoughts, and to link with the behavior. That way he can change him. Or you writing journal, you can write everything in a diary also. There is another technique called rational emotive pivot therapy by Ellis. So he say, not that perceptions or thoughts, he gives emphasis on beliefs. That is called REBT, REBT, rational emotive behavior therapy. They say the irrational belief itself is causing all this wrong behavior. So change the belief system. So he makes the ABCD approach, therapeutic approach. A is extreme event, B is the belief on the event, C is the consequence due to the thought, D therapist who wants the client to dispute the beliefs, and E is resulting modified behavior. This means here they say there is an external event, and the external event is having some beliefs, we have some beliefs on the event, and the consequences will be the feeling on behavior due to the belief. We have the thoughts about the event, and the therapist wants to dispute the belief now. You want to modify the belief, then if you try, then you modify this, then the result, you can result in modified behavior. So that way you can change the behavior through cognitive ways. So now I can tell you the life skills. So are you all? So I'm sure I have covered so many portions so hurriedly, but are you comfortable? Are you comfortable? Well, my dear participants, are you comfortable?
Yes, sir. We'll have to go through the books again, sir, and it will be clear
Ah,
later. Okay, sir.
okay. That way also you can ask me also. I have told you that you can ask me. So now I can try the life skills. You know, the last portion is the life skill, and the life skill, as you know, you, the teachers, you emphasize on the students in building skills, and skills are actually there are basic skills, and the basic skills are. Do you know what are the basic skills? The writing, the calculating, all these things. Your skills also. So you are having. Yes, I'm going to. The chapter is. Will you please tell me the chapter points? Anybody has having the chapter points?
Nine, sir. Unit nine.
In nine.
Unit.
Okay. In nine. That is actually uh, we are having the basic skills, life skills, isn't it? We have
Yes,
to
sir.
tell about life skills. We have basic
Developing core
skills,
life skills.
life skills, right? So here we the teachers know that the students have to be skillful, basically reading, writing, and numeracy. And these three, reading, writing, and numeracy, are called the basic skills. But it's not enough for the adolescent to be skillful to meet his all career ends. He has to be a good citizen. So apart from life skills, you have to know other. Apart from these basic skills, we have to know other life skills, and they are equally important. Even sometimes better than all these things. So to the skills, the WHO gives the name as core life skills. Core life skills, which enhances the psychosocial competence. And here, the core life skill, as argued or as pondered by the WHO, includes problem solving, critical thinking, communication, decision making, creative thinking, and interpersonal relationship. Also, self awareness, building, empathy, and coping. So, all these things are called core life skills. This self awareness, which is a core life skill, like creative thinking and critical thinking, is very effective. I can tell you what is that also, I'll describe. So, here, first, we can come to the problem solving. The problem solving deals constructively with problems. Then you come to critical thinking. It analyzes information in objective manner. Then you call to effective communication. It is expressing verbally and non-verbally in appropriate, in cultural and situation norms. And then also we come to decision making, how well you decide in some situations. Then you come to creative thinking. Here, creative thinking involves innovative ways of thinking, looking alternatives and various consequences we are thinking. We are looking beyond experience, generating new ideas, solving problem with new perspectives, adaptive and flexibility to situation, and creative thinking. And in interpersonal relationship, we just indicate the skill to start and end interaction in a positive and constructive way. Then self-awareness is a life skill that indicates your strength and weakness, your likes and dislikes, and also empathy, as you know, is very important. Empathy is a life skill. How you feel for others, your feeling about their feelings. Then coping with emotions. Then how you recognize your emotion and others' emotion too. This emotional management is coping with emotion. So all these are core life skills as advocated by WHO. WHO defines life skill as the abilities for adaptive or positive behavior to effectively deal with demands or challenges of everyday life. And it says that these are the life skills, core life skills, which are used to deal with the demands and challenges of everyday life. And UNICEF has defined life skills as behavior to address a balance of three areas like knowledge, attitude, and skills. The main components of life skills as advocated by UNICEF as critical thinking and decision making, interpersonal or communication, coping, and self-management skills. So these are the main components of life skills as described by UNICEF. So UNICEF describes core life skills like this as empowerment, which consists of self-awareness, communication, and resilience; citizenship, which contains or consists of empathy and participation; learning, which involves critical thinking, creativity, and problem solving; fourth, employability involves negotiation, decision making; resilience involves ability to cope with stress; participation is ability to contribute actively to process of situation, to process and situations and influence decision; then negotiation, the ability to persuade to agreement. So these are all core life skills according to UNICEF. The Harvard group, the Harvard school, you know, the best school in the world. The Harvard group identified same survival skills. They say the life skills are survival skills like critical thinking, collaborative thinking, agility or adaptability, initiative or entrepreneurship, effective oral or written communication, accessing or analyzing information, curiosity and imagination. So all these seven categories were advocated or described by Harvard Group. But Barry, one psychologist, he has given the name of 10 skills to survive in 21st century. He says 10 skills are very important, like critical thinking, communication, leadership, collaboration, adaptability, productivity, innovation, global citizenship, entrepreneurship, accessing or analyzing. There are 10 skills that is called 21st century skill or skills to survive in 21st century. Scott, another person, in 2015, he organized all 21st century skills and competencies for success in work and life. So he divided into 4 groups to discuss all these skills. So these skills are: number one, learning to know, learning to do, learning to be, and learning to live together. So 4 categories of life skills, which are grouped as 21st century skills. And the learning to know involves integrated content or knowledge committed to lifelong learning, ability to assess, and global awareness. Learning to do involves critical thinking, problem solving, creativity, information, communication, etc. Third, learning to be involves social or cross-cultural skills, personal responsibility, sales-making skills, and metacognition skills. And the fourth one, learning to live together, involves seek and value diversity, teamwork or connectiveness, civic, citizenship, intercultural competence, and global competence. So here, in this 20% school, there is a term called metacognition, also perfective thinking. So there are 2 important skills, very important school skills. The metacognition indicates thinking about thinking. So what we're thinking, its content, the nature, its genuineness, that is thinking about thinking is metacognition. And the perspective thinking is the art of thinking on others' view. These are 2 important life skills. And here, the 21st century skills, lastly, have been summarized as 3L skills. 3L: learning, literacy, life. So all these skills significant are summarized as 21st century 3 main skills. So one is the learning skill, and the learning skills involves critical thinking, which ensures fairness, which ensures openness, which ensures objectivity. So critical thinking is a very important learning skill in the first L category. This also involves problem solving. Problem solving means identifying the relevant ones. So while solving the problem, you identify the relevant one which can solve it. Also, innovation means new thinking. Collaboration means group involvement and communication, that is exchange of ideas and thoughts. So this is the first L, or learning skills. Secondly, the second L, as per the summarized 21st century skills, is called the literacy skill, that is information literacy, that is access from traditional or digital sources. So the information literacy means the source of information, where from where accessed. Also the media technology, that is called media technology literacy, the ability to understand, the ability to evaluate different aspects of content and informal and information. That is the literacy skill, that is what information, where from you have got it, And how to evaluate all these things? And the third one is third L, life skills, is flexibility. So, where flexibility is one important life skill. So the people who are not flexible, they suffer. The leaders who are flexible, they can only rise. So in the school, when you are a teacher, you may be principal, you may be headmaster, anything, you may be class teacher. If you become very rigid, then you will get the wrath of the students. So these things will be out of proportion, will blow out, you will be helpless. So always become flexible. You have made rules. Sometimes become flexible. So flexibility is a good skill. Flexibility, then adaptability, adapt to new changes. There are some changes, you don't deny it. You adapt to that. Leadership, responsible, or you become responsibly effective, you become sensitive. So here, this third L life skill includes sensitive citizenship, it includes initiation to do independently, self-direction, that is motivating self, doing with integrity, productivity, accountability, social and cultural interaction means to communicate and work together collaboratively. So this means now all these skills are discussed, starting from self-awareness to the communicate and working collaboratively or to collaborative efforts. There are so many skills are there. So it may be 10 skills as discussed or discussed by WHO, or it may be 3 area skills of UNICEF implement 7 skills of Harvard School, the core skills of UNICEF or the life skills of Harvard schools, or BES 20% skill, and Scott's grouping 4 skills, 4L, learning to know, learning to do, learning to be, and learning to live together. And lastly, the summarized 3 main skills, learning skill, literature skill, and life skill, indicates that all these skills are very important to make a person good citizen. To become a good citizen, to become a good person, you have to acquire all the life skills. Initially, I told you the basic skills are reading, writing, and numeracy. These skills are basic skills are necessary for the students because your assessment of the students is on that really basic skills because you give them marks, you give them division grades. But the teachers in the school, apart from those basic schools, they have to be very concerned with the life skills. The life skills give them more when they pass out the schools. Although these skills will be more useful in the school too. Apart from basic skills, the life skills are also very relevant. So the teacher should be always concerned to develop the life skills in the adolescents. So thank you very much. I'm sorry I became very hasty also to conclude the courses. So today's course and the left out course of the yesterday. Everything has to be finished today. So if you like, I can also clarify some of the doubts or something where you were not able to follow. I can clarify. If you ask me questions, I can give you 3-4 minutes or more, even if you like. If I have any doubt you have, I can clarify. So will you ask me anything? Starting from Sima, Uma, Katikrishna, Anupama, and so many, and other names are not visible. So you are all present, visible to me. So anything you like to ask me. So you have a book and you can follow you can read the book, and I think it will be clear. If you are not clear, you can ask me also later. I have given you my phone number. Even today, I completed I completed the assignment given to me. I was in haste also to complete it, and I feel that there may be some doubts in you because of my speed of covering. So if you like to ask me, I can clarify now. Now the time is over, but still then I can keep you comfortable for 3-4 minutes in exchanging views or clarifying your doubts. Anything you can ask me also.